Hello everybody, if it's your first time here, my name is Tin and I'm a current first year dental student at the UCLA School of Dentistry. And today Dr. Mike uploaded a video titled "Which is harder, medical school or dental school?" and we're gonna be reacting to it. Since I'm in dental school right now, I know exactly how hard dental school is. And let's just get right into it.
Dental school or med school?
I'm about to agree with Dr. Mike. I do think medical school is harder. I have a friend who has a girlfriend that's in med school, and what she's experiencing for sure seems a lot harder than what we're experiencing right now.
Dental school,
Is
obviously.
one organ versus 78 organs.
So we have to learn all the organs and specialize in this massive, most important organ.
That's actually very true, especially at the UCLA School of Dentistry. There's a lot of medical school type classes. It's very didactic heavy. I just finished a Systems 1 course, which is all the systems in your body. We covered the circulatory system, the pulmonary system, the renal system. So yeah, we do learn about everything. The cardiovascular system is actually very important because it connects everything, and there's a lot of bacteria that can enter through dental procedures. And if you have a condition like infective endocarditis, we have to know what that is in order to give you AB prophylaxis so you don't die. Yeah, I think that's very important, but things like the pulmonary system and the renal system, after we're done, I have the privilege of forgetting about it or not remembering them as well. But with medical school, you have to remember everything.
Name 3 organs in the abdominal cavity.
We have a cavity. Speaking of cavities, let's talk about your cavity.
4 years of education plus at least 3 years of residency.
4 years of dental school. If you want to specialize, you could get into another 4 years of residency or 3 years. It depends on the specialty. Not only are you reading books and memorizing facts, but you have to be really good with your hands.
Okay, that's true. We have to be really good with our hands because when we're working inside the mouth, everything is in terms of millimeters. And in those lab courses, a millimeter could be the difference between you failing and passing the practical. So your hand skills have to be on point. Dental school, you have the didactics courses plus the lab courses on top of that. I see lab as something that I enjoy. I can definitely see how it can be extra difficult if you have a lot of didactics going on, plus you need to catch up on your lab work. We have projects due every week. That can really be tough. For me personally, I just disregarded all my didactic courses and I spent too much time in lab. Yeah, so but that's what I enjoy, and I think it's been working out so far. I've been passing all my classes.
Not up to here, but superior.
And if you're a surgeon?
If you're a surgeon, then you're a surgeon.
I mean, we are surgeons too. Doctor of Dental Surgery, so that's the DDS degree, or Doctor of Dental Medicine, the DMD degree, which are both equivalent, by the way. One is not superior to the other.
How many schools did you apply to, and to how many were you accepted?
You applied to only one school?
One school, and I got into one school.
That's actually
I
crazy.
would not recommend
You're
that.
confident.
I would not
Yeah,
recommend that. My parents, I'm very lucky. Both my parents are dentists, and they both went to NYU Dental, and I just saw that as the school to go to. They gave my family an opportunity to become who they are today, and I was gonna do whatever I needed to do to get into this program and school. So the majority of you, please apply to many schools.
Yeah, I actually recommend, I think the average is around 13 to 15 schools because you're already applying, so you want to get it over with one and done, and you will kick yourself if you only apply to 3 and not get into 3, and then you have to reapply. For me personally, I applied to 9 because then my stats were pretty solid. I don't know about my personal statement. That can be a topic for another video. If you want me to walk through my personal statement, my application for dental school, just let me know and I'll make a video. If this video get 1 like, actually 2 likes, because then I'm gonna like this video myself. But if this video gets 2 likes, I'll make a video going over my application and which schools I applied to. But I'll just go over it quickly right now. So I applied to 9 schools and I got interview invites to 5. I went to 3 of those interview invites and I got accepted to all 3. Imagine if I applied to 3 schools and it was the 3 that didn't hit me up at all, you know? So apply to a lot of schools.
One for one.
But my dad also went to the same school.
We are following in our family's footsteps, and we're very lucky, right? We're both very lucky.
Yeah, we are.
Yeah. My dad was a singer and my mom was a performer too. So I don't know how I ended up here, to be honest.
Our parents did it both as immigrants, right?
That's true. Our parents did it as immigrants who spoke different languages, and we were lucky enough to following their footsteps.
And I really love how diverse the medical and dental field has been getting lately too.
What was the best part of medical or dental school?
So why was that the best part?
Why? Because I went into this field to help people in dental school, to be able to work on patients prior to becoming a doctor. I thought it was such an amazing thing, and you started your patient skills in dental school.
So I actually was a dental assistant for 4 years before dental school, and the patient to provider interactions is one of the best things about working in healthcare. Even though not every patient is gonna be a star patient and everything goes well and perfect, but I think learning from each patient and providing the best care that you can, it's something really rewarding. I'm still a D1, so I haven't gotten the chance to work with patients yet, but I'm really looking forward to being in the clinic next year.
Also have doctors that have retired that are there supervising.
I've actually been curious about that. Do you practice on a mold first?
Yes, so we practice on mannequins that don't talk, don't respond.
Really?
You can take
but
out,
it's a real, like everything in the material's the same?
no. It's like plastic teeth.
Oh. But is it a realistic teaching experience?
Not at all. Because human beings talk back to you. Human beings,
They move,
they move, like, everything's
yeah.
moving. This mannequin is the perfect patient.
Yeah.
The mouth is open, and you could open and stretch it
So
as
you never
much
had
as you can.
standardized
Sometimes
Okay, so we have to actually put a lock on in our typodont, which are the fake teeth, so that the patient can't open their mouth fully all the way. And there's also a plastic cheek covering that we have to pull it and retract. I think that it's a good representation. Of course, it's not going to be perfect, but I think it's a good way for us to learn before treating an actual patient.
sometimes people could even take out the teeth out of the mouth and drill it
Yeah.
and put it back.
Oh, they did that?
Okay, yeah. Some people do that. I don't personally. I think I want to have as much practice inside the mannequin so I can deliver the best care for my patients in the future. At first, we do practice with the typodont, the fake teeth outside. We just hold it with one hand and then we drill with the other. But then we have to move on into putting inside the mannequin and then work on like our chair positioning, ergonomics, and everything.
Wow, they cheated.
Little cheaters, I see you.
Wow, okay. So for us, it was different because we had standardized patients. So
What does that mean, standardized patients?
they're paid actors
Really?
to act with certain conditions.
That's cool.
And you would literally walk into a room and you would not know what's going on, and you have to treat it like a real patient encounter, and it's time. You have like 15 minutes or whatever the time was to find out what's going on with them. They're all trained to give you some scenario with practiced, rehearsed answers, questions, but then also they have something unique going on.
And they're really good at it too. My girlfriend's actually going to nursing school at Western U, and they do have this simulation patient. I think it's a really good learning experience. Some people are shaken up after the simulation, so I can see it definitely helps getting that interaction before treating actual
They have
patients.
something unique going on.
That's really cool.
They're really mad, they're crying, they're throwing up. They would literally have stuff in their mouth and spit it out. And then you'd get graded on the encounter from the video
they're really
session
good. The
and
actors
your
are really
note,
good.
how well it was written. But Cadaver Lab was the coolest part.
Speaking-
That's
but-
nothing to do with what I just said. For me, Cadaver Lab was the coolest part because you get to see the parts of the body that you only see in textbook. You realize what a mishmash the body is inside. You grow a respect for the body.
In dental school, we do have cadaver lab. I had it fall quarter of my D1 year. So right away, you get cadaver lab. And it was an eye-opening experience for sure. And I really appreciate people that donate their body for us, for our learning. And each cadaver has its own story. And it's very interesting seeing the different diseases or conditions that the cadavers have. Seeing cadavers face for the first time was an experience for sure.
But at the same time, when you're studying for the test and it's midnight and no one else is there and it's dark, it's kind of spooky.
That is very spooky.
Yeah, that actually happens because then the cadaver lab's open 24/7. You can go in whenever to study on your free time, and it does get pretty spooky in there.
How much did it cost to go to medical or dental school?
Dental school is a lot more expensive than medical school. There's a lot more tools and instruments that we use. I'm lucky enough to get accepted to UCLA. We have one of the most affordable tuitions. So I'll be transparent with you guys. For my first year of dental school, I pulled out $65,000, and that's including everything. So tuition, my living expenses, and my apartment and everything. I think that's a pretty low number because dental schools have been getting crazy expensive lately.
For you.
Is it ever 3 years?
UOP is actually the only dental school in the United States that has a 3-year program, which is insane. I think we're already so packed with materials and so stressed that to condense that down to 3, I don't know if I could handle it personally, but UOP dentists are great and amazing. So yeah, it's working out for them.
The worst part of medical or dental school?
How often did you get a test? Because I still remember.
Honestly,
my
I felt like the second. Welcome to NYU Dental School. You have an exam tomorrow. Like, what the heck?
No, for
I
sure.
just-
For our first week, we already have 2 quizzes. Like, huh? Boom, quiz first day, and another one on Wednesday. At UCLA, especially since it's a quarter system. So at first, it start off with exams like every other week, and then after the halfway point of the quarter, you get exams and quizzes every single week, which is really stressful.
I did the best that I could. I spent extra hours working on my craft, and I think they saw that. They saw how hard I was working, and I saw that they were willing to devote their energy and time. And these teachers, professors, don't make any money, really. So they're doing it from the bottom of their heart.
I actually do want to go back to school as a faculty instructor or professor one day. I think it's a very fulfilling job, even though, yeah, I won't be making a lot of money. So maybe pay off my debts first, and then we'll talk about that later. When he's talking about working on his craft, I think that it's often overlooked because people only care about grades. But I think having good hand skills, being able to provide good product and outcome for your patients clinically is really important to me too. So I do spend a lot of time in the lab.
What would you describe your personal life while in medical or dental school?
No, but I disagree with yours.
Let me see.
See, I think mine happens to be sad, but I don't think it needs to be sad.
No, for
I think
sure,
you
for
can have
sure.
a personal life.
It's very possible to have a personal life. You should have a personal life. You're not only a student, but you're a human being first. Take care of your mental health and physical health too while you're in dental school, because burnout is real and you should really take care of yourself.
What were on your exams? I'm always curious about that.
What's your name? That's a good one. That's a good start.
Okay, I hope that's not the only thing.
No, I
they're
mean,
asking.
we took...
Like, are they asking you questions about, like, white blood cell function?
Exactly. Pharmacology, any diseases.
No, for sure, it's a lot more than just teeth. That's why I thought before going to dental school that, oh, we're gonna be learning about teeth all day and the mouth, but there's actually a lot more involved. So last quarter, we took Foundations of Basic Sciences, which is all the undergrad biology that you learn just crammed into one class. And then this quarter, we took all the systems. So as I said earlier, the pulmonary, circulatory, the renal system. It's very holistic. What Dr. Mike said about what our exams are on, pretty much any disease, like whole body, microbiology. And it's not just microbiology of the mouth. It's like every bacteria, fungi, virus you guys can think of, and pharmacology, our lab, our direct lab. So yeah, there's a lot that can be tested on. And we get tested every week. So
Any diseases?
Yeah.
Or just dental diseases?
It was
Like
sort of-
autoimmune disease?
Exactly.
if you think about it, it's all connected, right? So we learn about xerostomia, which is dry mouth, and there's multiple systemic diseases that can cause it, like systemic lupus and Sjögren's syndrome, diabetes, HIV. They all cause dry mouth. So yeah, it's very holistic.
So in order for us to understand the head and neck, we have to understand how the body works, because the mouth is connected to the rest of the body.
For sure, before dental school, I used to think, oh, the mouth is so isolated, but it's really not.
Really?
Yes. As we went closer to graduation, it would go from really broad to more narrow, and then teeth.
Okay, no, yeah, for sure. It's really broad right now, which kind of sucks. It's actually very important, but yeah, it does suck. It's a lot to remember and a lot to learn.
Teeth is the last thing that we focused on.
Okay, it's not the last thing we focus on throughout the 4 years. So there's always a class specific to the oral cavity. Our fall quarter, we had morphology. So we learned about the structure of the teeth, how each different tooth have different characteristics. My favorite tooth is the second maxillary molar because of the oblique ridge. I think it looks sick. Then this quarter we had direct, so we're working on the teeth. And next quarter we have the face and the tooth. We have morphology again. We had karyology, so which is a study of cavities and the bacteria and conditions inside the mouth that can foster cavities. We do have classes on the oral cavity every single quarter. It's not just at the end, right, when we graduate.
The Krebs cycle and add improv. There's a movement to remove the Krebs cycle from education and instead bring in like a more humanistic approach and less scientific approach to medicine. And I think that's a mistake. I think you need to keep the scientific knowledge in, but our communication.
Yeah, I think it's good to keep scientific knowledge in, but I already learned about the Krebs cycle like 3 times in undergrad, learn it again to take the DAT. I think it's a little bit excessive to learn it again in dental school or medical school. So I actually don't agree with Dr. Mike here. But I think the improv idea is actually really
Patient sucks as doctors.
legit. Yes.
So we need to add improv,
Yes.
which forces us to leave the book and stop thinking about the future, which we all do
Amen.
in healthcare, and think about the moment. Even we communicate.
It's very important to not go by the books. Look, I mean, you should go by the books and the law, of course. But I think it's important to learn that medicine and dentistry is not just ABC. So it's not like a list of things that you do. Each patient is very different. The circumstances are very specific to them. So it's good to have improv or like those acting simulations that I told you guys about, so that we can think about how we can personalize our care to the patient and not just like follow a checklist of what to do. Last quarter I actually learned about this. It's called evidence-based dentistry. So how we should treat the patient as an individual and have patient-centered care instead of just treating the symptoms, but to get to the root of the cause. No pun intended.
Give to someone just starting medical or dental school today?
Don't let one exam or class
You left me hanging there.
deter you from achieving the goal of why you started medical school or dental school. Whatever grade you think is the worst grade in the world, learning how to move on past that and keep moving forward and doing the best that you can, I think that's the most important. Do not let one exam or class change
So
that.
get back up on the horse.
Get back on that horse and keep going.
I think that's really important, especially if you're in undergrad right now and you want to be a dentist. One failed exam can feel like the world is ending and that dental schools won't accept you. That's not true. It's okay to fail as long as you get back up and keep on trying. I actually dropped out of Calculus 2 during my first semester in undergrad, and hey, I'm still here, and that's fine. In dental school, there's definitely times where you fail a quiz, fail an exam. That's okay too. The professors are here to help you, and they really want you to succeed. Our anatomy professor, which is one of the best professors I've ever had, actually told one of my classmates that as long as you're trying, you will succeed. The professors are working so hard for you to be successful, and the school is not going to give up on you. They need that money. And he said this specifically, you're not going to fail unless you give up. So as long as you're trying, you will be successful.
Make sure you're doing it for the right. I was gonna write reconsider, but I don't want people to think that I'm discouraging folks from going into medicine. It's still worth it because the field is so rewarding and it's so much fun and it's really cool. But with all those challenges, you better be doing it for the right reasons. Because if you think you're doing it to get rich or you're doing it because
It's
Papa Bear
cool
did
to
it,
be a doctor or whatever the case is.
I think it's one of the worst ways to get rich. I'm gonna be super in debt by the end of school. I won't make back that money for a while. And schooling is hard. You're going through all the stress. And if all you're doing it for is for the money, you're not gonna enjoy life. You're gonna burn out. Thinking about money will only get you so far. You have to love what you're doing. As they say, if you love what you're doing, wait, what do they say? If you love your work, you're not working a day in your life, or something like that. But yeah, so love what you do.
Or med school or dental school?
What did this guy write? I think medical school and dental school has the same amount of problems and trauma, mental trauma, all that stuff. But if you do it for the right reasons.
No, I agree. I think that both are really hard.
I think they're both hard. I prefer dental school. I mean, that's why I'm here. I prefer the hands-on aspect of dental school. If you have a harder time with your hand skills, maybe dental school will be significantly harder. I mean, that's just what I think. I'm just one dude. But yeah, I do think medical school is harder. I mean, don't get me wrong, dental school is plenty hard. But if you guys love dentistry, keep on pursuing it because it's very rewarding. And I love every second of every day that I'm here. So yeah. I hope you guys got something out of this video. Like the video if you guys liked it. This quarter is looking pretty busy, so I'll try to do what I can with YouTube. That was a very interesting video. I really enjoyed watching it. Thank you, Dr. Mike, for uploading that video. I'll link his original video in the description below. Make sure you go check out that video too. Yeah, I'll see you guys in the next one. Bye. Subscribe. Please.